Hi, good afternoon, everybody. My name is Dr. Eileen West, and I am presenting COVID-19 updates today. This is part of a twice a month series that we have started, and I'm very happy to present a wonderful colleague who's also part of our Eileen West MD and Associates practice here, a nutritionist, Mary Hunt. And after a few minutes of update from a statistics standpoint and COVID-19, I am going to hand over the microphone to her, and we'll hear about some suggestions and thoughts that she has regarding nutritional support of the immune system. So without further ado, I will go ahead and jump in. Today is September 17th, 2020, and we are in the midst of our COVID pandemic. It continues. At this point, the global numbers are up to 29 million, nearly 30 million cases, with yesterday's average of new, over the 7-day rolling average of new cases being 191,000 new cases yesterday globally. To date, worldwide, there have been approximately 939,000 deaths, and the number continues to climb. There are a number of countries, of course, that are seeing pretty high positivity test rates, now over 15%, which is 3 times the World Health Organization benchmark. The US is number 1 in terms of total cases at this time with 6.6 million. India is catching up to us with 5 million plus cases, and Brazil is sitting at 4.4 million cases. In the United States, there are 6.6 million cases with roughly 24 to 25,000 new cases per day over a 7-day rolling average. And we are approaching 200,000 deaths in the United States. The number 1 state that's involved with total cases is California at 771,000 cases. Texas is next with 696,000, and Florida with 671,000. So Virginia, where we are, is at 15th on the list as far as total cases go. The bad news for us over these last 3 days is that the US test positivity rate has jumped significantly by 27% in the last 3 days. And of course, that's concern for the possibility of a new spike associated with Labor Day weekend and the return to school. So we're watching this closely to see where all of this goes. In the state of Virginia, we've seen 137,460 cases and about 1,000 to 1,100 new cases daily. There have been 2,900 case deaths so far. And the 7-day positive rate in the state of Virginia is 6.7%, although the majority of that activity is still occurring now in along the coastline and in college towns. Unfortunately, Harrisonburg, Virginia has been hit quite hard, and we're starting to see additional cases grow in other college towns around the state. Overall, nationally, we're doing 1.8 million PCR tests. We have done a total of 1.8 million PCR tests, which is a good number. The opportunities for testing continue to grow. And in Fairfax County, where we reside, there are now 25 or 30 locations where you can go to get tested. In Fairfax County, we've seen 20,000 cases total. There are an average of 85 to 100 new cases daily. So far to date in Fairfax County, we've seen 586 deaths. And Inova Fairfax Hospital, which is the largest healthcare provider in our area, has done over 88,000 tests with a positive rate, with a number of positive tests, about 11,000. but only at this time are there 55 hospitalized patients for COVID-19. So it's we have not yet seen a rise in the number of hospitalizations in this area. So I wanted just to speak for a minute about testing, because as people return to school and businesses start opening up again, and people are starting to return to work, there is a lot of discussion about testing. The good news is that we have a lot of different types of tests. The bad news is that none of them is absolutely perfect, but we do at least have the ability to check someone and do serial testing with some of these tests that may not be picture perfect. I'm happy to announce that in our practice, we are now able to offer the BD Veritor rapid antigen test, which gives us results in approximately 15 to 30 minutes. So we are offering that service to members and non-members of the practice, and it involves a consultation just to decide whether a rapid test or a PCR test or an antibody test are really the best options. So, and we offer all of those in the practice. So there are a number of new items to talk about. I'm not going to spend a lot of time on any one particular one because I want to make sure that we have time to hear from Mary. There is news on the vaccine clinical trials, which unfortunately is not great news. Some of you may have heard that the AstraZeneca Oxford University vaccine was held trials and administration of new vaccines for a time after one of the participants was found to have a reaction. They believe they are still investigating the cause, whether it is truly related to the vaccination itself versus some underlying, an unmasking of an underlying condition. But the problem was with a case of spinal cord inflammation or transverse myelitis. And that is being investigated very closely to see what comes of it. As a result, that study has also been put on hold here in the United States. And the FDA is evaluating closely to see when and if it will be safe to resume that trial. So unfortunately, not the news that we want to hear, because we're really all counting on a vaccine sometime in the near future that will allow us to get back to work and to school and to our daily lives safely. But at this time, we just have to be patient. So, all right, without further ado, I would love to go ahead and let Mary get started with her discussion. If you'd like to learn more about her credentials and about the work that she is doing, please feel free to jump onto my website, Eileen West MD and EileenWestMD.com, or Mary's website, which is healthyrd. Is that it? HealthyRD.
It's Heart Healthy RD. I want to make everyone's heart healthy. Yeah, this is a tough time.
Perfect to be associated with an internal medicine practice. I love it. And especially also with women's health, since 1 in 3 women will eventually succumb to heart disease. That is a really great thing to be paying attention to early. So, all right, Mary, take it away.
Okay. Well, I'm truly honored to share this time with Dr. West. I have so much admiration and respect for her, and I truly believe that there's so many factors that we can control. There's so many things that we can't, but there are some that we can. And some of the things I'm getting somehow. Can everyone hear me? Can you just let me know? Because
there is some feedback on when you're speaking. Do you have another speaker or
okay? There is
connection somewhere.
I'm not quite sure what I need to do. But I'm getting feedback. Can you hear me? Yeah. Not quite. I'm not quite sure how to do this.
Do you have any other things open on your screen?
bottom, I guess I could X out, just a little feedback. Yeah. Not sure if I should close that down.
Let's go ahead and proceed. Let's just go ahead. We can hear you. We can understand you.
Okay. So what I was,
maybe mute your or turn down your volume a little bit.
Okay. Try. Okay. Can I exit? Okay. Okay. I'm not quite sure how I'm going to do this.
Do you
okay. So what I wanted to, am I a little bit quieter now? Okay. Sorry, I'm not screaming now. So some of the things that I would like to talk about today there are some things that we can control. And we do know that having some conditions will increase our likelihood of having more complications if we do get COVID-19. So there are ways that we can boost our immune system. And I've actually kind of developed an acronym or 4 words that I kind of wanted to go over today. Self-care, self-nurturing through things other than food is so important right now. Obesity, diabetes, hypertension, any kind of lung disease are major risk factors, major complicating variables for the COVID-19. So what we really want to do is we want to control our weight. We want to control our blood sugar. We want to make sure we get our blood pressure checked. And it's so important. I was just hearing a report this morning that a lot of mammograms, women are even going for their mammograms now because they're afraid of going into the clinics. But it's actually so much better to get your blood sugar checked, to get your mammogram, to monitor your blood pressure. It's actually safer to go in and get these numbers monitored than to stay home and have complications. There's some breast cancers. We're really worried that some are going to go undetected. Managing your blood sugar is so incredibly important. And so I came up with these 4 letters, and it refers to self-care as well. Want to work on self-care. For a lot of women that I've been seeing, I've been counseling patients as we've been going along here. I've been doing a lot of telehealth conferences. And a lot of women, we take care of our children now. It's even harder having a lot of the kids home. We take care of our elderly parents. We're working, we're managing so many things right now. But managing our self-care is number 1. When you take care of yourself, it's one of the best gifts you can give to your family, to your work environment, to your friends. So S stands for structure. Having structure in our eating is extremely important. Having 3 meals, I believe in having 3 meals a day with 1 or 2 snacks. When people skip meals, a lot of times what they do is they get overly hungry, or they're more tempted to snack. And when they are snacking, they're not going to snack on carrots or apples and cheese. Most likely they're doing some kind of processed foods. And those are inflammatory. We're trying to decrease the processed foods and the added sugars. So structure to your meals is really helpful. Within 1 or 2 hours after you wake up, you don't have to have a large meal, but something with a balance of lean protein, of some kind of a carbohydrate. Don't fear the carbs, the slow release carbs, the whole grains, the legumes, the fruits, the vegetables. Also having a source of protein and fat 3 times a day. And again, you can have like a large snack, but at least have something to keep your blood sugar stable. By spreading out your food through the day, it helps with your blood sugar stability. It helps control your blood sugar elevations. It also helps control your appetite. So you're less likely to get overly hungry if you have 3 more equal size, more balanced meals. So S stands for structure, 3 meals plus 1 or 2 snacks. It also stands for sleep. Think of sleep as guardian for the brain. If you don't get enough sleep, those hunger hormones go crazy. You're more likely to overeat. You're more likely to snack on foods that you think will bring your energy, but they don't. They may make your blood sugar go straight up and come back down again. So getting enough sleep, getting some kind of structure to your meals is extremely helpful. The L stands for listening to your body. Ask your body, what does it need? A lot of times we eat when we're hungry, when we're anxious, when we're lonely, when we have the TV on, when we're thirsty. A lot of people eat just because they're thirsty. So maintain your hydration, making sure to get beverages that don't have a lot of added sugar. I think it's great to have a water pitcher with some sliced, I either do lemons, limes, even orange slices. You really want to stay away from a lot of sweetened beverages, especially those coffee drinks. We want to try to limit our added sugar to no more than 24 grams a day for a woman, 36 grams for a man, and one 12-ounce sweetened beverage can have up to 32 grams of added sugar. So really try to watch any kind of beverages that have a lot of added sugar. So L is listening to your body. Try to eat mindfully, try to eat in one place, pay attention to what you're eating. When you're on the computer, when you're eating, when you're watching TV, your stomach will get full, but your mind doesn't register that you've eaten. So really kind of listen to your body. Are you hungry? Are you tired? Are you thirsty? And to really pay attention to what your body needs. A lot of times when people go 3 or 4 hours without eating, say they have a banana and some cereal for a snack or for lunch, and then they're hungry 3 hours later. Well, maybe they didn't get enough protein, or maybe they didn't have something that would help stabilize their blood sugar. The protein, the fat, and the carbs all combined together will satisfy you the longest. So L is for listening to your body. And then, E, I'm sorry, I missed E. E is for the environment. So it's S, the sleep, the structure. E is for making your home food friendly. Looking at what's around in your environment. Do you have a lot of chips? I have parents coming in, oh, my kids are eating all the chips, they're eating ice cream, they're eating all this. My spouse is getting into all this food that they shouldn't be. So don't buy it. I believe in only having foods at home that you can have a serving of. So that goes back to being aware of what you're eating. Look at the serving size. If you have more than a serving of, say, some kind of a dessert or a snack food, I wouldn't have that at home. Make your home food friendly. So E is also for the environment, to go to more a plant-based diet, more of a Mediterranean style diet with more legumes for the protein source. The countries that live the longest actually eat a little bit of meat. They don't eat a lot of meat. And in the US right now, we're getting way too much meat and protein. What the best thing is to spread the protein out through the day. And getting more beans and legumes are an excellent way of getting plant-based protein. So we have S with the structure, we have E for the environment. We want to eat the least processed foods as possible. L is to listen to our bodies, to eat when we're hungry, to eat to nourish ourselves, not to nurture ourselves. And then F stands for frequent movement. One of the things that is so beneficial to improve our immune system is not only eating fruits and vegetables and whole grains and lean protein, unsaturated fats, unprocessed foods, but also to move. We need to move. When you move, your immune cells actually are supercharged, and that can last while you're exercising and even 2 or 3 hours afterwards. So getting some kind of movement through the day, every half an hour to an hour, even if you just stand up and move your legs, it helps with blood sugar control. I always say motion is lotion. If you have any kind of arthritis, if you have any kind of back pain, stand up, even just 5 minutes, even going to a bathroom on a different level of your house is helpful. Getting outside, there's something actually called ecotherapy. Go outside, even if you just sit out for 5-10 minutes and watch the clouds go by or listen to the birds. just getting outside can be a huge way to decrease your stress. So again, the S stands for structure, for getting adequate sleep, E for the environment, for eating the least processed food. Whole foods are the best. They always talk about only eat foods that your grandmother would understand the ingredients for. So, again, the fewer the ingredients, the better. To listen to your body, find out if you're actually thirsty, hungry, tired, and then F is the frequent movement. So self-care is just the most important thing you can do, and to really try to manage your weight, manage your stress. Another real important aspect as far as our immunity goes is to reach out to others. A lot of us are stressed. A lot of us are feeling very isolated. And just taking the time, actually one of the best things I think about going outside and walking and being in nature is just getting in touch with your neighborhood, talking to people, socially distant, but being outside in nature and also connecting with people is extremely important. I have a lot of resources for movement. A lot of people don't like to walk outside. There are a lot of great walking programs on YouTube. Even at my yoga studio, Sun and Moon has a live a YouTube broadcast every morning at 10 a.m. You can connect with the yoga instructors there for a half an hour. There's Jessica Smith YouTube has some great walking videos. She has bars, she has weights. There's another British woman I just love now. Her name is Gina B. She's got some great walking programs. So even 5, 10, 15, 20 minutes throughout your day really helps to get some kind of movement, some kind of joy, some kind of connection. So questions for me. How can I help? How can I support the people that are listening in on us today? Questions?
Are there certain foods that boost immunity?
Yes, there are. So when we're thinking about the environment, you're thinking of a rainbow of nutrients. The more color you have in your diet, the better. So if you think about your plate and you take half of your plate actually should be from non-starchy vegetables, fruits. People are so afraid of eating fruits because they have sugar in them. Fruit does not have added sugar. It's the added sugar that we're worried about. But an orange, apples, blueberries, I call blueberries God's candy. The berries are some of the best for our brain, for our immune system. But oranges, any kind of reds, the oranges, any kind of fruit or vegetable is great, as long as it's not fried and as long as it doesn't have added sugar. But it's really a great thing to try to get more fruits and vegetables in throughout the day. And if you're not doing very much now, even frozen fruits and vegetables, I call freezing nature's pause button. So actually frozen fruit and vegetables can be even fresher than the ones we get in the grocery store, because when they freeze fruit and vegetables, they pick them, and then within an hour or two, they're flash frozen. So they pick them at peak ripeness, and then they're frozen. By the time we get fruits and vegetables, they're picked, not at peak ripeness. They're stored, they're transported, they're stored again. We bring them home, we store them, and we eat them. So frozen berries, I always have frozen berries in the freezer, strawberries, some of the blackberries, and it doesn't have to always be organic. Organic is preferred. There's something called the Dirty Dozen that, if you can to get the organic, but actually just eating more fruits and vegetables, whether they're organic or not, that is what's important. So great question. Thank you.
That's terrific. The first time I learned about how the flash freezing process really captured things at peak ripeness was just amazing to me, because so often we've been sort of trained to think that frozen food just isn't as good as fresh food. But in this case, it's really not true.
Even fish. So when you see the fish on the counter, when you go to a grocery store, most of it has already been frozen and they just defrost it. So fish. Oh, so that's another actual thing. Another topic I wanted to mention. When you defrost meat, so if you do freeze things, one of the things that we're concerned about is, how we're managing during the COVID. A lot of us do not want to go grocery shopping that often. Actually, so COVID-19 is a respiratory. It's transmitted via your respiratory system. So it actually dies pretty quickly on surfaces. I mean, it is there. You do need to wash your hands. I would wash the produce. But it's really not going to be transmitted so much through the food as through the utensils. That if you have shared utensils or you're in a shared eating space, you take your mask off and you're right beside someone. But what I was going to say about the frozen food, be careful when you defrost meat, defrost it in the refrigerator. You have to be so careful about defrosting things. I would not defrost anything on the counter. And actually, even with frozen fruit, I don't even defrost it. I just kind of rinse it out and we'll put it in a bowl or put it in some yogurt. But actually, for frozen fruit, you don't want to have it too defrosted because it will get the cells, the integrity of the fruit won't taste quite as good.
Do you think that there are certain foods that help to reduce stress for people? There's so many, I'm hearing so much about COVID-related stress now, where people are really struggling as this goes on longer and longer and longer. They're, how to juggle their work lives, how to balance kids at home, how to, assist kids with online learning. There are just so many, a lot of people are having serious sleep issues and serious stress issues. So do you have any suggestions for us about specific dietary things that will help with stress? And also any, recommendations in general for sleep? Are there any nutrients that might be helpful to help people get a better night's sleep, for example?
So, those are excellent questions. So unfortunately, there aren't, the best way to manage stress actually is to try to keep your blood sugar stable. And so by eating slow release carbs, more complex carbs, you want to stay away from a lot of processed foods or a lot of foods that will just make your blood sugar go up and then come back down. So having balanced meals, the more whole grains, those feed the good bacteria. And so getting more whole grains, some dairy products without a lot of added sugar. So you really want to stay away from a lot of added sugars. Added sugars are inflammatory. So eating more fruits and vegetables actually makes people feel better. Another great thing is that helps with depression. And, it's pretty controversial right now, but we do think that fish, the omega-3s in there, fish is one of the best protein sources that you can have. There's the small fish are the best. Some people are worried about mercury, but salmon, sardines, mackerel, anchovies, those are, the smaller fish. I would eat more fish. Fish is one of a great food that we can work on. Tuna fish sandwiches for lunch. They have those little packets of tuna, which are excellent sources of protein, omega-3 fatty acids. As far as keeping the anxiety, eating sweets, if you do want to have sweets, the problem is you have to have a serving of it. When you eat too much, a lot of people will feel guilty, and then it makes them even feel worse. So if you can have a dessert that does have a little bit of protein, that does have a moderate amount of carbohydrates, a half a cup of ice cream with some berries or some sliced banana would be great. Or even some cocoa almonds. Some of those are great. Some shredded, I love shredded wheat. A lot of my patients love that they put cinnamon on it or cocoa powder on it. But the more whole grains seem to really help with blood sugar and to keep us feeling, we want some carbs, we want some sweetness, but we also, want to feel good after we eat it. As far as what helps us sleep at night, having a moderate amount of carbohydrate, not a lot of protein, not a lot of fat 3 hours before you go to bed. So just a small snack. Snacks in general should be between 100 to 200 calories with a little bit of carbs, maybe a little bit of protein. But an excess amount of fat and protein before you go to bed is really going to interrupt, most likely, your sleep. Alcohol is also an interrupter of sleep. And in order to stay healthy, that's another important aspect of our health, is to limit alcohol for 1 serving a day for a woman and no more than 2 servings for a man. So limiting the alcohol is also going to be helpful for minimizing our risk for breast cancer.
Yeah, that's there's been a lot of emphasis on that recently in the last 12 months or so, looking at the fact that more than 3 alcoholic beverages a week for a woman can increase your breast cancer risk almost as much as taking postmenopausal hormone replacement. So it's pretty significant, and important to pay attention. So that's another reason why that movement, I cannot stress the importance of trying to move every day. Get out at 30 minutes. It doesn't have to be. I say movement. I just said that, came right out. It doesn't have to be exercise. Just moving our bodies. Just everyone thinks, well, if I'm not working out, it doesn't count. It does. It really helps. And I probably see my little watch here. It reminds me to stand up every hour. And I just love those little rings. It's been so helpful for so many of my patients. I have some patients that they may not only move 1,000, 2,000 steps a day. And I just say, just go up another 500. Just average yourself for the week and then just slowly increase. Some movement, some activity is better than none. So one of the best things you can do really is to move your body. It really helps with sleep. It helps with blood sugar, stress management. I cannot stress the importance. Our backs, I'm actually on a yoga ball right now, one of those fitness balls. Our posture, a lot of people are, we're leaning down over the screens. For our kids, we need to get them to move more. I'm so worried about them sitting at computers for a long period of time. So getting them outside to play, I just think it's, when did exercise become exercise? We want to play more and just to get moving, do something fun. I love Zumba's fun, any kind of music that can make you feel good. There's so many YouTube videos out there right now. Yeah. I know we instituted the early morning walk, and that is, we're going 3 or 4 miles in the morning now, and it changes everything. I feel so much better when I do that. I just am focused and awake and ready for the day, and it just helps me stay calmer. And I know that I don't have to worry about steps because I've already done it. Right off the bat, first thing. It
sets the stage for the rest of the day. And actually, when I was talking about 3 meals a day, thank you for bringing that up. When we include a good source of protein and fiber at breakfast, it tends to help us curb our sweet tooth in the afternoon. So say you have a slice of bread with 1 or 2 tablespoons of peanut butter and say a Greek yogurt with minimal added sugar, like some of those Chobani-less sugars, the Siggies are excellent. When we have a good source of protein, for women, even 15 to 25 grams of protein 3 times a day per meal. But when you get the good protein, you get some fiber, some whole grain cereal, some oats, it actually helps stabilize your blood sugar. And there's some studies that indicate that it actually reduces your urge to want to eat processed carbs later in the afternoon. And the morning walk, again, sets the stage. When you walk in the morning, you're less likely to, you're more likely to eat healthy throughout the day. It's like, wow, I just walked. Do I really want to go and have a quarter pounder with French fries and a milkshake? Which again are, we want to really try to eat as healthy as we can. with,
processed foods.
yeah.
Let me ask you about, have you heard anything, Mary, about magnesium and sleep? I'm starting to hear bits and pieces about that there are some products on the market now that have, a couple of 100 milligrams of magnesium in there and a little bit of zinc and some vitamin D, which are all in combination being used, that are supposed to help to upregulate brain function and allow people to have calmer, go into deep sleep more effectively. Have you heard anything about that?
There's so many. As far as the evidence-based nutrition studies on that, again, I would just try to eat fruit. Have a banana, have a bowl of melon, with it. So there, although the magnesium, it is hard. A lot of women do not get enough magnesium, and men. So sometimes having a magnesium supplement is okay. So that might be something helpful. But again, as far as, I believe in whole foods. The problem with supplements is they're not regulated by the FDA. A lot of them do have fillers. A lot of them vary from one supplement to the next. So getting as much whole food, I would really work on having, a piece of fruit, getting some melon, berries, or even having a glass of milk or some yogurt. Some of the unsweetened soy milk is also beneficial because it does have a lot of calcium in it. But you did mention vitamin D, and that is one thing I did want to bring up, because there are some studies that are indicating vitamin D is pretty controversial. There's so many studies that indicate it may be beneficial with depression, with bone health, with so many different factors. And even with COVID-19, actually, I've read. And vitamin D is a little bit harder to get through your diet. So having, I'm not, I really am not going to recommend to take it, but it wouldn't be a problem if you took 1,000 to 2,000 probably IUs a day. So vitamin D is one of the supplements I do tend to recommend, or at least to get your vitamin D level checked.
Especially as women head into menopause, it's particularly important because we want to preserve bone health the best we can. And there's a clear association between very low vitamin D levels and autoimmune disease, first of all. So we don't know. It seems as though the autoimmune disease then correlates or has some causative relationship with low vitamin D. And then that low vitamin D leads to problems with our endocrine system as far as the calcium, calcium metabolism and preservation of good, strong bones. So vitamin D, I think it's here to stay. I think we've been talking about it now for an extended period of time, and we have enough solid data that having normal vitamin D levels is something that occurs in people who are healthier. And so it's important to figure that out and to understand. And, many times it's not even totally necessary to check a vitamin D level frequently. We do in our osteoporosis patients, and I'll do it periodically for my patients. But just taking 1,000 a day to, as you said, 1,000 to 2,000 IUs a day is usually sufficient. And it's possible to get some, vitamin D is produced naturally. The active vitamin D is converted by sunshine in the skin to the form that we need. The inactive form is converted to the active form. But you have to be careful with that too, because you have to weigh the risk of being outside at noon without any sunblock on, because that's when the conversion happens.
Right. But they're actually saying that, it's just 15 to 20 minutes. So it doesn't take long.
The skin flashes pink when it pinks up a little bit. It's different depending on your skin tone. It depends. For some people, it takes a little bit longer. For others, it's shorter. It's more quick. But yeah, it's definitely something that I think it's important to pay attention to. And I'm with you. I don't recommend supplements routinely, but I do think that vitamin D is a good one. So.
And again, as far as the magnesium goes, that's I always say that, if you really want to take a supplement, I mean, take it for a certain period of time and see if it improves. And if it doesn't, then stop it and see. Don't just take a supplement. I mean, most of the times we're not deficient in vitamins and minerals. I mean, and so unless we're deficient in something, taking a vitamin supplement is most likely not going to be that helpful as far as immunity goes. But again, connection, exercise, eating a plant-based diet, eating more lean, less processed foods, getting adequate sleep. Those are all things that we can control. Making our environment food friendly, really watching what you bring in your house at this point. When we're stressed, food is such an easy way to nurture ourselves. So one thing that I always like to recommend is you want to use food to nourish yourself, not to nurture yourself. To really try to find ways that you can nurture yourself other than through food. Taking a bath, anything that will help calm and relax you. One other useful tool that I found is something called the Calm app. There's an excellent app. It's called the Calm app. And it also helps with sleep. They have some great sleep stories in there. You can just meditate for 10 minutes. The woman is so relaxing, and she always has a nice message. But one of the Calm apps is one of the ones I strongly recommend.
That's great. That's great. We had a question, does using the microwave impact the nutritional value of food? This is an interesting topic. People have been asking this since microwaves were invented. What do you think, Mary?
So it usually doesn't. The most important thing with a microwave is you want to use microwave safe containers. So do not, I'd only microwave, the best thing to microwave with are glass containers or ceramic containers that are made for the microwave. I do not microwave any kind of, I would really try to stay away from plastic containers. But if you the minimal amount of water that you use, the less nutrients that you're going to lose. So microwaving is fine. And it's quick and it's easy. I think microwaving is great, and I do use a microwave oven. Even some of the frozen meals now come in paper bowls. Healthy Choice had these power bowls that are now paper. So even some of the frozen meals, they're portioned, they're quick, they're easy. They are more processed, but it would be a lot less calories, a lot less sodium to have one of those Healthy Choice power bowls than to go out and to eat, order something, a large sandwich in and some chips and a beverage somewhere. So having said that, I have no problem with the microwave. It's a great way. Yes.
Good to know. All right. I did miss one question earlier that asked about who's a good candidate for a rapid antigen test for COVID-19. I'm just going to touch back on that for a minute. So the best candidate for a rapid antigen test is somebody who has symptoms or has a direct known exposure to a person with COVID-19. The higher the likelihood of it actually being a positive test, the better a test it will be. So I think people are very interested in having a test that they can have the results back in 15 or 30 minutes. And it's great that we have that. But the best candidates are people who actually may have significant symptoms or people who know that they're going to be tested regularly. So every 3 days, every 5 days, every 7 days, because that way, if you have some inaccuracy with one of the tests, then you know that there's another test that will be backing it up. So that's what we suggest. I think it's important to know that if you're traveling internationally, and there are people who are traveling internationally now, most countries that you go to will not accept the rapid antigen test. They want you to have the PCR nasal test, the nasal swab. But it's helpful to have these tools available to us. And if you really get into a situation where you think you may well be positive, then it's a good idea to get checked. So, all right. I think that may be it for us for the questions. Mary, it is always such a joy to talk with you, hear what you have to say, and your suggestions and your ideas are always spot on and so useful for all of us. So I really appreciate you being here.
Thank you. And thank you for including me today. It was just really wonderful. Thank you.
Terrific.
Appreciate it.
Do it again.
Okay. Okay. Thank you.
Everybody. And thanks for tuning in. And we'll look forward to seeing you next time. Take care.